Hello, fellow classmates. Dr. Karen. Alex here, and this week I'm going to be talking about POTS. I hope you brought your pans. You might be wondering, what is POTS? POTS is Postural Orthostatic Tachycardia Syndrome. This is an abnormal autonomic nervous system condition characterized by orthostatic intolerance, meaning the body does not compensate when it changes position. For example, sitting and then standing will induce a reflex of tachycardia or rapid heartbeat in a patient with POTS. This will cause dizziness, nausea, or even could trigger a syncope episode. What causes POTS? Low intravascular volume. Therefore, if you have low amounts of volume of blood in your body, therefore you have a decreased stroke volume, you just will overall have a lower blood pressure. You could have a congenital defect where your left ventricle is smaller than it needs to be, and therefore when blood is pumped to the rest of the body, you're not getting enough blood through each pump. Folks who have autoimmune disorders are predisposed at a higher rate to get POTS. Folks with POTS have been likened to people who have been bedridden for a long time. Population affected. Women are much more affected than men on a rate of 5 to 1. 5 to 1. It is also, POTS typically is diagnosed and the onset occurs in puberty, so it doesn't start right at birth. It waits until you enter puberty or early adulthood, and then symptoms become more severe and hopefully a diagnosis can be made. This brings us to our case study. Today we're going to be talking about Mandy. She's a 19-year-old woman, and she was an active student until she was about 15 years old, her sophomore year of high school. And then she began to experience severe abdominal pain, headaches, fainting spells, extreme fatigue. Despite consulting multiple healthcare providers, including a pediatrician and a GI doctor, no physical causes for these symptoms were identified. She was then referred to a psychiatrist for manipulative, malingering behavior, where she was then admitted into a psychiatric treatment facility. She then spent a year there without improvement. Afterwards, she was then discharged, and her neighbor, having seen a news segment on Postural orthostatic tachycardia syndrome, POTS, suggested to Mandy's mother that Mandy's symptoms may be POTS. Her mother agreed, and Mandy was then referred to a cardiologist. Before we move on in the case study, let's do a quick recap. During puberty, Mandy started to experience severe abdominal pain, headaches, fainting spells, extreme fatigue. Let's think back to the second slide that had the symptoms of POTS. Early onset, nausea, fatigue, fainting. Those are all crossover with the symptoms of POTS. The one major difference, however, that Mandy did not mention was tachycardia when standing. Tachycardia when standing is a major indicator of POTS, and I think if she had tachycardia, and if she had this and then communicated she had tachycardia, she might have avoided being admitted for a year. But that didn't happen. Also, it's a side note that her neighbor had the good intuition to maybe recommend a workup for Mandy for POTS. So at this time in the case study, she's been referred to a cardiologist. It was not outlined in the case study, but let's just go ahead and make an educated guess about who was present during this cardiologist consult and any follow-up visit that was needed. First and clearly, there would be a cardiologist doctor or a cardiovascular PA or nurse practitioner. Likely there would be another nurse or scribe or MA or similar tech which would be assisting the provider. Mandy herself would be present. I'm also thinking that maybe Mandy's mother would be in the room. We know that Mandy's 19 and is an adult. However, because the case study mentioned her mother's involvement, it would be a reasonable conclusion to think that Mandy's mom was also in the visit. And finally, an interpreter. Every case study, every encounter always has the chance for an interpreter. At this point in the case study, Mandy is now in the doctor's office with her cardiologist. The cardiologist will have collected her history, and a table tilt test was then ordered. And that is what this picture here is showing, the table tilt test. I know what you're thinking now. What is a table tilt test? Great question. I found this great brief YouTube short describing the tilt test that was ordered for Mandy by a cardiologist. So let's listen to it now. All right, great. Hope that cleared up a few questions. Let's go to the next slide. So this is our table tilt test. As described in the YouTube short, the table tilt test will strap a patient to a table that can then be raised and lowered at various angles. The patient is also connected to many monitors that will collect data about the patient's heart rate, heart rhythm rate, respiratory rate, blood pressure, and oxygen saturation. After the tilt test, all this data is reviewed by a cardiologist and their team. In this photo, we can see there is an EKG setup with some electrodes. There is a blood pressure cuff. There is also an IV that can administer medication in the case that a patient faints or needs revival. If you haven't guessed already, Mandy's test was positive, and therefore she was diagnosed with POTS. But what does a positive tilt test indicate? All of those various monitors that were connected to the patient, they are evaluated. And if the heart rate is outside of normal limits, or the blood pressure or the respiratory rate goes outside these certain guidelines, then that can indicate a positive test. Additionally, if the patient faints or reports feeling lightheadedness at any time, that can also cause a positive positive table tilt test. What about Mandy though? What is her prognosis? Good thing. The prognosis for POTS is relatively good. It is a non-life-threatening condition and typically can be treated with lifestyle changes. Additionally, POTS sometimes can spontaneously resolve on its own without treatment. So maybe Mandy will be one of those. The treatment of POTS focuses on a few key areas. First, the doctor wants to increase her intravascular volume. She can do this by drinking more water, and this helps improves her blood circulation and increases her overall blood volume, which will then increase her stroke volume, which will then increase her blood pressure, so she's getting oxygen to her brain. Physical exercise. This may sound counterproductive, but as symptoms of this condition are fatigue, a gradual but consistent incorporation of physical exercise can build tolerance and reduce these fatigue symptoms. Lifestyle changes. For example, returning to school or work with a modified schedule can help manage these daily demands while coping with a condition such as POTS. Lastly, wearing compression garments are advised, like compression socks. These socks can improve blood flow back to the core of the body, and this will also help reduce any dizziness or fainting. This case study does have a happy ending. After the positive tilt table test confirmed the diagnosis of POTS, Mandy and her family worked with her cardiologist to create a management plan. She increased her daily exercise, and she started on a medication, midodrone. Midodrone targets low blood pressure. They also collaborated with the schools and the nurse and the teachers, allowing her to return to her high school, but with shorter days. This new diagnosis and new plan, she was able to graduate high school, and today she is now attending nursing school and is on a journey to help others who may have also been misdiagnosed like her. Overall, this was a good case study. There was lots of good detailed information about what POTS is and how Mandy was managed. Also, it is a nice heartwarming story at the end to follow a patient from when they are in their teenage years and how they were affected in high school and how the diagnosis was made, modifications and treatments were implemented, and then as she went on into her career in young adult years, that she is pursuing medicine because of this condition. I just felt that was a very nice, touching story. Even though this was a good case study, I do have a couple of improvements I would recommend and that I had hoped for that I just didn't get. First, and I think most important, is I would have liked more details about the table tilt test itself. Instead, I had to go out and I found that great YouTube short that I shared with you all and a couple of great pictures that describe the table tilt test. But the case study itself included very minimal information about the table tilt test. Another thing I would want to include is just additional details about maybe the causes of POTS. So before diving into the case study, as I did explaining what POTS is. And additionally, maybe at the end, a small thing, there was the medication that was mentioned and there was no other medications alternatives mentioned. So maybe just including what else is on the market would have been nice. But all in all, I feel like this was a quality case study and I'm happy to have studied it. Before I go, let's finish up on rural and low-income patients and how they might be affected by POTS. In Mandy's case study, she saw many different providers before she was correctly diagnosed. If you are a rural patient and you have to travel to multiple different doctor's appointments to get to your final correct diagnosis, that might be prohibitive for you. Or if you're low income, don't have insurance, are subject to a high deductible, you may not be able to afford many different office visits before you can get a correct diagnosis. I would make the assumption then that folks who are rural or have low income might be diagnosed with POTS at a lower incidence. Additionally, many jobs might be prohibitive if you have POTS. If you are rural and work in agriculture or in mining or out in the forest service, you might need some modifications to help with your fatigue that you might not be able to find. Additionally, low-income folks, if they are working hourly jobs and are on their feet all day, working a restaurant, working as a nurse, working as a house cleaner, being fatigued and having POTS might affect their ability to work as many hours as they can, and therefore they will continue to receive less hours and therefore be paid less. Another thing to consider is family support. When you have POTS, you might need the additional support of your family or friends or financial assistance so that you can support yourself or buy the necessary modifications that your lifestyle requires so that you can still be comfortable while having this condition. The final thing I do want to say is in my research on rural and low income patients and how they can be affected by POTS is that POTS is actually considered a qualified disability and folks can claim Social Security benefits if they have POTS. This means you can be 30 and take out Social Security instead of being 66, I believe it's these days. So yes, POTS is federally qualified disability. All right, class and Dr. Karen, that is the conclusion to my Week 9 ANS PowerPoint. And today we discussed POTS, we discussed a lot about the table test, and we discussed some treatment plans for POTS and how rural and low-income patients might also be affected if they're ever diagnosed with POTS. Thank you, everyone, and we'll see you on campus. Bye now.